The Canadian Parks and Recreation Association is a national organization that is dedicated to realizing the full potential of parks and recreation as a major contributor to community health and vibrancy. For 60 years, CPRA has been the national voice for parks and recreation, advancing collective interests of our members through leadership and advocacy, policy, and research. We are a national network dedicated to the well-being of people, communities, and natural and built environments. And we serve as a resource for our members and partners by contributing knowledge and opportunities that enhance and grow the sector. Our CPRA staff of 8 is supported and strengthened by the experience, expertise, and network of the staff and board members of our 13 provincial and territorial association members. We also work with volunteers, government partners, and a number of allied sectors such as physical activity, sport, education, public health, and others that help us to make progress on our goals, and we strive to help them meet their goals as well. CPRA is engaged in a number of initiatives, unfortunately too many to talk about today, but I did want to mention the bench, which we introduced in the summer of 2020. This is CPRA's online community, a place for the sector to meet, work, and grow together. The bench features COVID-19 and other resources, events, discussion groups. There's a portal, 2 portals actually, one dedicated to the framework for recreation in Canada and one to Parks for All. There's professional development opportunities and a new job board. And coming later this fall, we'll be relaunching an updated benefits hub, so stay tuned for that. So I really encourage you to sign up for the bench, share the link with colleagues, and to help this grow as quickly as possible, the more you contribute and interact with it, the more opportunities we'll have to work together as a sector. So just a couple of housekeeping items before I turn it over to my colleagues. As I mentioned, we are using simultaneous translation today. There is a note in the chat box about how to access it, but again, it is the Globe Live translation icon at the bottom of your Zoom window. Through today's workshop, and I'm going to ask our facilitators to just turn their cameras on for a second, we will be discussing some of the content. We'll be asking some questions and sharing ideas in different breakout groups. We have, where we've had enough people, divided you into different regions across the country, and based on whether you're in a small center or a large center, we've tried to put you with your colleagues as well. So we have pre-assigned those breakout rooms, and as I mentioned, they are being facilitated by our senior staff from our provincial and territorial associations, as well as some of our board members from across the country. So I'm really grateful to them today for their support. For those of you who are from Quebec, your sessions will be conducted in French, and you'll also have access to simultaneous translation. You will have an opportunity to ask some questions in the breakout rooms, and we will collect these, and I'll also be checking the chat box for some questions, and we'll attempt to get to some of those today, but where we can't, we will be featuring some of those answers on the bench in the coming days. At the end of the workshop, you'll have an opportunity to complete a survey, and we would really appreciate your feedback. This is the first time that we're doing a more of a workshop format with these facilitated breakout rooms, so we'd really love your feedback on it. And also, you'll be able to access the recording of this at cpra.ca at the end, again, in the coming days as well. And then finally, we've started a discussion group on the bench to address many of the topics that we'll be talking about over the course of the next 5 workshops. So if you haven't already joined the bench, I would encourage you to do so and keep an eye out for those discussions. So I think that's it for me. Again, I hope you really enjoyed today's workshop. I'm really excited about it. And I'd like to introduce Mike Roma. Mike is the chair of CPRA, CPRA's board of directors, and he'll bring some greetings and introduce our speakers today. So thanks, everyone.
Thanks, Krista. On behalf of the CPRA board, welcome and thank you for participating today. CPRA is proud of the work that we've done, and that the work of the Reimagine Rec team, as well as our partnership with Sport Canada that helped us produce it. One of the key themes that was identified through the Reimagine Rec knowledge gathering that's facing leaders at all levels right now is making a safe return. And that's really what today's workshop is all about. This workshop and others to follow, as well as a speaker series, are part of CPRA's commitment to knowledge translation and dissemination. And we've actually been joined by the Physical Activity and Recreation Committee in this effort. So the first person that I want to introduce everybody to is Susan Goletz. So Susan is the Director of Sport, Recreation and Community Programs with the Ontario Ministry of Tourism, Culture and Sport. And today she's also here representing the Physical Activity and Recreation Committee, or what most of you know as PARC. So Susan, I'll turn it over to you.
Thanks very much, Mike. It's a real pleasure to be here today, and I want to give greetings to everyone who's participating. As Mike has suggested, I am a representative of the Federal, Provincial, Territorial Physical Activity and Recreation Committee. I'm also the co-chair for SPARC. And it's a real pleasure for me to join you today in support of this important webinar on the safe return to recreation, physical activity, and community sport. It's clear that Canadians value community sport, recreation, and physical activity. However, as we are all well aware, the COVID-19 pandemic has impacted and is continuing to have a significant impact on the sector and on the opportunities that Canadians want to have to access recreation and participate in active living. It is therefore vital for all players, including government and stakeholders, to share research and learnings and to discuss the implications for the renewal and recovery of recreation, physical activity, and community sport across the country. And I'm really pleased and thankful that CPRA is hosting today's webinar. I hope that you all have a very productive and successful learning afternoon. Thanks.
Thanks, Susan. Next, I'm going to actually introduce our two presenters. But before I do, I just want to say thanks again to the facilitators and the translators who are going to help make this workshop run smoothly. The first person I wanted to introduce is a gentleman named John Frittenberg, who was the project lead for the Reimagine Rec initiative, and he's also the president of the JF Group. So the JF Group's a nationally recognized consultancy specializing in sport, recreation, and the physical activity sector. Throughout his 35-year career, John has assisted municipal, commercial, and nonprofit clients stay abreast of key trends while developing strategies for success. The JF Group's client list includes federal, provincial, and municipal governments, as well as national, provincial, and municipal sport and recreation organizations that operate facilities and deliver sport and recreation-related services. Thanks, John. I also want to introduce Joe Duaron, who brings over 30 years of experience in health promotion and partnership building to his current work as a facilitator, partnership broker, community activator, and thought leader in healthy public policy working at the national, provincial, and local levels. Across his eclectic career, Joe has developed and delivered many public health initiatives focusing on population health that serve all Canadians across the life course and that address the social determinants of health. Joe began his career with Participation and then spent over 2 decades at the Public Health Agency of Canada, facilitating innovative social policy initiatives in healthy living and chronic disease prevention. So I'm very honored to introduce both of these gentlemen, and I'll turn it over to John to lead us through the festivities. Thanks, John and Joe.
Thank you very much, Mike. And welcome, everybody. Thank you for signing up for today's workshop. We're very excited about information that we're going to deliver here today. What we're going to go through, I'll give you a brief overview of what the Reimagine Rec Project was all about. Then we'll talk about some big picture items and also about coming back to open up the sector in the safest possible way. But I honestly believe, and we structured the workshop in this manner, I honestly believe what you're going to learn will be augmented tremendously from discussions you'll have in the breakout groups. Because we know that the pandemic is influencing provinces and territories and communities within each province and territory differently. So consequently, the division of the groups and the structure of your session, I think, will give you a real fulsome look-see into what your neighbors are doing and how they can learn from you. So let's talk a little bit about the Reimagine Rec project. As Mike was mentioning, it was a knowledge gathering project. It lasted for approximately 6 months, beginning in January of 2021. There are 4 key elements to it. The first was a review of published and relevant articles. These were international in scope and took into account a whole variety of different environments, sport, recreation, physical activity, and so on. About 245 of these documents were actually analyzed and were reported on. There's also a survey data. We decided not to actually survey the sector because we learned early on that there was a whole variety of surveys that were already undertaken, recent surveys, some of which were undertaken by sport organizations, others by allied organizations, CFLRI, for example. And so we looked at all of the data from existing surveys, and about 130 surveys were analyzed in this regard and reported on. We did, however, do direct inputs from 170 different key informants from across the country. This also included 5 special interest groups representing inclusion and diversity, Indigenous groups, gender equity, education, and school sport. And then lastly, we solicited promising practices from across the country, of which we received approximately 70. And that all that information was analyzed and reported on. 4 different reports were created, 1 summary report on top of that. All of those are available on the bench. I would encourage you, they're extensive documents. Lots of the information you're going to hear today is detailed. We can only briefly talk about it here today, of course, because of time constraints. But I really encourage you to do that. Also on the bench, there are infographics, which we created under the Reimagine Rec banner in order to be able to give you key messages and images that you can use to promote this to colleagues, superiors, elected officials, and so on. So that's about Reimagine Rec. In terms of what we're going to be talking about today, we're going to be delivering as much knowledge as we can, both from the Reimagine Rec project as well as information that has been developed since the project was complete in June of this year. There is emerging information that is coming, and as I said earlier, the pandemic is affecting different areas of the country differently, and is being shaped by public health policy in those jurisdictions. So as a result, we're going to be delivering as much information to you today as we think we possibly can in order to be able to allow you to develop your own strategies and plans that are applicable locally, because it'd be very difficult for us to create, for example, a recommendation that was applicable across the entire country because there's so many differences, and we'll talk a little bit about that. So these are not recommendations, but rather information upon which you can develop your own plans. Let's talk a little bit about the big picture. First of all, COVID, the World Health Organization declared a global pandemic in March of 2020. And I don't know about all of you, but I certainly didn't expect that the pandemic would be as far-reaching and as long as it has turned out to be. So it has really affected us, and over the last 19 months, we've developed a fairly significant body of knowledge, both from initiatives such as Reimagine Rec, work that CFLRI has done, work that other organizations like Jumpstart has done. And so we know that the pandemic is going to have has had long and lasting effects on the way the sector operates, and likely is going to affect how we are going to operate facilities, develop facilities, deliver programs and services well into the future. We now know that the virus mutates, and that the mutation, such as Delta, is more contagious and possibly even more resistant to immunization. There are new ones on the horizon. Fortunately, at this point, they don't appear to be quite as infectious as Delta. But we do know that this is likely to be an ongoing struggle. And there are certain studies that are emerging that would suggest that COVID is not going to be eliminated, but rather controlled. In other words, it'll be more of an endemic approach, similar to the virus that we deal with on an annual basis. The flu virus that we deal with on an annual basis. And as I say, things are different across the country, not only province by province because of the various public health measures, but also, Joe, I think we just lost the slide. Anyway, I'll keep going. Things are different across the country, driven by public health agendas. And we do know that there are even differences between jurisdictions within provinces. So for example, just talking to somebody today, rules that are affecting the Lower Mainland in BC are different than those rules that are affecting the interior, even though they're within one health ministry. So as I say, things are different. So consequently, keeping your ear to the ground and learning what is coming down the pipe is very well advised. Lastly, we also know that there are unintended consequences from things, things that we are being asked to implement that are clearly for the betterment of the sector and the participants within the sector, but pushback. And many of you probably have already experienced this, either hesitation for vaccinations or pushback with respect to certificates or vaccine passports. And also the messaging has not always been as consistent as it could be coming out of various official authorities. So a few things that we know. First of all, prior to the pandemic, we know that Canada had a physical inactivity problem. But then the pandemic arrived and we had to shut down our various facilities and discontinue programming. This, of course, eliminated opportunity for activity for those who even were going to undertake it. We know that physical inactivity causes a decline in causes people to be more susceptible to disease, including COVID. And we know that people who are inactive have the likelihood of different sorts of impacts that are more severe than people who are more active and more physically fit. So consequently, the whole thing was just exacerbated by COVID rather than caused by it. We also know that there were pre-existing cracks in the system. We know, for example, and COVID has shown us this, that there are and were systemic barriers for various groups to enter into our programs and to our facilities, largely underserved, racialized, and women and girls. We also know that there was a labor shortage in our sector prior to the pandemic. It has now been exacerbated by it. And we also know that the infrastructure was aging, and a lot of our facilities were old. And when you hear about the engineering aspect of what we're suggesting are possible mitigations, the age of facilities is one of those things. We also know through the REC program that community sport and recreation activities are valued social services. In fact, they are seen as social services now rather than something different than that prior to the pandemic. So recreation and sport participation is seen as contributing to community well-being. That is, without question, the public sentiment out there. And there's a new understanding for the value of these services being delivered to the public. The public's attitudes have changed, and they have heightened appreciation for physical activity, especially activities that are occurring in the outdoors. And many of you will remember the flocks of people that populated the parks and trail systems throughout the country once the facilities were closed. Safety is without question the number one priority of people. We've heard that time and time again through our research. Technology is the new frontier. Technology is something that was used by our sector prior to the pandemic, but it just took off when the pandemic actually hit. Apps are being used for program delivery. I personally believe that post-pandemic hybrid systems, including partially programs delivered in person and partially through virtual means will be a thing that stays. Online training is already happening, this being a good example of that. Automation that reduces high-touch surfaces is also on the forefront of needs, and also or at least technology is being used for contact tracing. We also know that we can leverage the sector's ability to be adaptable. Recreation and community hubs were one of the first places that were used as testing sites and later for vaccination sites. So consequently, we already knew that the sector was fairly adaptable. And in fact, we received many reports, positive reports of the adaptability of recreation staff. Internal communication and consistency is a must within organizations. That's without question has been shown throughout this. Education of staff and establishing new boundaries of behavior for them, especially given that they're going to be required to do new types of activities, is important. And also seeking out new and up-to-date information. And again, not to beat a dead horse, but I would suggest that you frequently visit the bench to see the new information that's coming. With that, I'll turn it over to my colleague, Joe, who will go through a few slides pertinent to today.
Thanks, everyone. John spoke, of course, about the big picture, and we do want to reinforce and acknowledge again that the situation is unique to every jurisdiction, every region, every municipality, and even down to neighborhoods and obviously individual organizations that you represent. However, in a broad sense, the sector remains on a broad journey together. And as a consequence of that journey, which began in March of 2020, we're in a better position to respond. And so here you see that in March 2020, we were all in a position of disorder, obviously with the closures that were in place as a consequence of public health measures. That really was exacerbated by the fact that we had no playbook. Obviously, the globe had no playbook. This was a first time event. There was no ability to respond when the sector was closed, and there was no ability to control the outcomes. As we moved towards the summer of 2020, we got a little better as a sector. We began to share information. We began to adapt our responses to the real-time situations. And we began to innovate in the early sense with trying new things and trying to essentially deliver programs and services in a way that was in keeping with the limitations of the public health measures. But then we were hit again, weren't we? In the late of 2020 and the early of 2021, after some opportunities for reopening across the country, we were hit by the second and third waves, depending on where you were. As a consequence of that, though, we were better able to respond as a sector generally. There was increased collaboration. There was better informed response in real time to the challenges and issues and impacts that were at play. And we were able at that juncture to be able to test innovative approaches that were of benefit to our patrons and to staff and volunteers. But here we are in the fall of 2021. We are not out of this yet. That is evident to all of you and all of us. But we are stronger as a consequence of unity and partnerships. We're coming together around more evidence-based information that allows for a greater response to the challenges. And we are at a place where we're beginning to gather proven innovation. So we're gathering information to know what works. And in short, this is the forward journey that we've been on, for lack of a better way to describe it. In March of 2020, we all retracted. In the summer and into the early part of middle part of 2020, we began to retool around new innovations. We then regrouped again in the fall and winter of 2021. And we're in a point of renewal, generally speaking, with differences, of course, as John has pointed out, across the country. We are not there yet in terms of renewal, and that's why that arrow continues. But certainly we're in a better place in terms of being able to respond collectively to the challenges that are before us. So there is cautious optimism ahead of us in some ways. Just recently, StatsCan released information about the GDP by sector, and the arts, entertainment, and recreation sector grew at a rate of 8.1% over June to July. And that's a difference of 18 or 19% when you compare it to July of 2020. So we're on the right track. That's not limited to recreation. It includes other general areas of delivery in Canada. But with respect to employment, generally speaking, across culture, recreation, and information technology, the employment rates are up. But cautious optimism in that when we look at just released statistics in September of 2021, we see that recreation and sport program leaders, frontline leaders, in many cases, leaders like yourself, are still underemployed, with 17,000 fewer employed leaders as of September of 2029. Those are some of the references that we've pulled from Stats Canada. So for today's interactive workshop, we want to achieve three things. Over the next 90 minutes, we want to deliver knowledge and insights across the three areas of content that we've talked about. We'll frame that knowledge that has been gathered by CPRA and the Reimagine Rec Initiative around an evidence-based hierarchy of controls that you can apply and use to mitigate risk. We'll discuss how to apply it across the three domains of safety, and we'll invite you to engage, as John has noted, in peer-to-peer discussions to discuss the relevant issues, to challenges, and opportunities. So what is a safe return, and what is the hierarchy of controls? As mentioned, when the pandemic began, there was no playbook. We could not respond in the context of closures, and we lacked any direct control over the delivery of programs and services in our sector. And as all sectors of society journeyed towards trying to recover and renew, leading sectors who are on the front lines, like primary healthcare, sought to identify solutions. And simply put, those solutions were focused on two objectives. One, a return to normal social, economic, and business life, of course, but also centrally health protection, right? The mitigation of risk from infection and illness due to COVID. And the hierarchy of controls that you see here for COVID-19 prevention is a recognized evidence-based approach to containment of hazards resulting from COVID-19. It's applied worldwide across sectors as a framework to guide decisions and priority actions that aid in the control and spread of COVID-19. And it includes 6 strategies that applied in hierarchy are your best bet in terms of investment of time, energy, resources. And we're going to talk about them across 4 tranches here. You can see from the four arrows. And the primary message here is applied concurrently. All these strategies result in lower risk, but the evidence shows that the greater reduction in risk results when you apply the greater attention to the strategies at the top of the hierarchy downwards. In this context, there are other things that you are considering in real time in your workplaces, in your recreation centers, in your community sport organizations. These include, of course, local and provincial public health measures, including proof of vaccination. You have to abide by and work in the context of occupational health and safety standards and regulations, Canada Labour Code, existing HR policies and standards, and other issues. And before I move on, CPRA wants to acknowledge Kevin Wilson, Joseph Miller, Zachary Evans, and Denver Brown at the post-secondary institutions that are noted here for their work in identifying the connection for our sector to this hierarchy of controls. And you can find their paper at the link provided at the bottom of this slide. So what are the 3 domains of control that we're going to talk about today? They are, of course, facility design and operations, staff safety and support, and keeping clients safe. And the participant breakout rooms that we'll go into in due course, we'll invite you to discuss the application of the hierarchy against these domains of safety. And so now I will pass it back to John.
Thanks, Joe. So as Joe was saying, I'd also like to thank Kevin and his fellow colleagues for the work that they did on sourcing this method. I think it's a very logical and evidence-based approach to grouping responses in terms of where you, as Joe was saying, get the biggest bang for your buck. It's interesting because sport and recreation activities generally cause a higher rate of elevated respiration. And we know that COVID is in large part spread through airborne particles. Not to diminish the need for surface sanitation and that sort of thing, but most of the evidence points to the fact that airborne particles are the culprit in terms of the spread. So consequently, given our services cause people to be in environments where, number one, it's difficult sometimes for them to separate or to distance. Number two, they have higher levels of respiratory activity, therefore expelling more particles than they would if they were sitting at rest. Our sector was seen as one that really needed to be controlled, and hence I think, although I'm not sure a lot of thinking went into it at the very, very beginning, but our facilities were closed. As you know, there's still hesitation in certain parts of the country to reopen certain facilities. Fitness is a good example of that, with no control on top of the capacity limit. So the sector is definitely seen as one that could, in fact, end up becoming a hotbed for spread, although I haven't personally seen too much evidence where that is, in fact, indeed the case. So, as Joe was saying, the top performing mitigation factor is elimination or substitution. And what that means, elimination, that means eliminating the entry of the virus into your facilities. And the most effective way of doing that, of course, is not to open your facility, simply to close it, and that environment is safe because nobody's entering it. But that's not a reasonable solution. So the next is substitution. And what that means is making sure that people are vaccinated and making sure that you are screening the people as they come into your facility to ensure that it's only vaccinated people that come into your facility. Now, I realize that that is an issue, and as I said earlier, there is pushback on that. But where there is public health policy that backs you up on this particular area, we know that the elimination and substitution element of this is the most effective. So passports and certificates and screening people as they come into your facility is extremely important in mitigating and most effective in keeping people safe within the facility. Next slide, Joe. So the next level of activities that are also deemed as being very, very effective in increasing the safety element within your facilities is engineering the indoor environment. This is, when we did the Reimagine Rec Project, before we had the additional information that has emerged recently, we were calling on the sector at least to adopt medical level design standards. I had occasion recently to frequent or to visit a brand new hospital in Toronto. And I must admit, even though that hospital was designed years ago and took several years to get constructed, you would think that that facility was built with COVID in mind or with pandemic prevention in mind. With big, wide open hallways, high ceilings, obviously very efficient air handling systems and so on. So establishing medical level design standards in any retrofits or new builds would be very, very advisable. Given that it's an airborne transmission, the need to introduce new air or exchange air in these spaces is very, very important because the air quality is the highest priority amongst safety measures. We know, as I said earlier, that many sport and recreation facilities throughout the country were already dated and their systems were already in need of attention, if not replacement. So we've got sport buildings that are old, some of them in the 70s, 80s, and early 90s, narrow corridors, dated HVAC systems. So consequently, just not really conducive to having the most effective mitigation. However, we now know the sorts of things that need to take place in order to be able to make those spaces safer. The introduction of high intensity air displacement systems is one. Portable air cleaners, high efficiency particulate absorbing filters, or HEPA, is important. Disinfectors of the air is another. There's increasing evidence that creating different and more air zones where air is not allowed to move between secure zones. We also have seen advancements in environmental monitoring technology that actually detects virus in the air. A lot of this is coming out of Asia at the moment, this type of technology, particularly applicable to locker rooms and in wet areas. Automated ventilation procedures, so that it's not something that has to be attended to by staff in every case. Obviously, it is automated. Installing no touch surfaces technology. In the hospital I referred to earlier, you wave your hand in front of a sensor. You don't even touch the sensor for it to open up doors. And sanitation initiatives, disinfectant stations, and hand washing stations, and cleaning surfaces more frequently is certainly advisable. Even though we know that the air is the most important factor. And from other factors of engineering indoors, obviously, most of you are likely already doing some of these, making sure that your staff are eliminating pinch points and managing traffic throughout the facility. There are several articles that suggest that people should be encouraged to arrive just at the beginning of their program and leave immediately afterwards to cut down on the number of people within a facility at any given point. Capacity limits on programming. I know this is an issue that is going to cause some of you angst because, of course, if you're reducing a class size from 30 to 10 or 15, depending upon your jurisdiction and the standards that they're using in terms of social distancing, that is obviously going to have an impact on your revenue stream. So while some of these things are good for safety, they're not necessarily good for your business model. And we understand that, yet the whole idea here is to create safe environments. Establishing desirable distances for different types of activities and the different environments within your facility is also quite advisable. There's lots of good data on that, much of which is contained in the reports I mentioned earlier that are available to you on the bench. But establishing standards for within your facilities for different types of activities that might occur in a group setting, might occur and resulting in more close proximity between participants is something that you should take into account. Obviously, spacing your equipment wider apart so that people are forced to distance. And also, if you happen to be operating an older building with narrow hallways, you may decide to only have one hallway going in one direction, another hallway going in another direction, so that people aren't passing by in narrow hallways. Either as you can, or in any kind of new builds where there is new technologies introduced, automated check-in to get rid of or reduce the number of pinch points that we typically had used to control access to buildings in many cases. That they need to be mitigated and to make sure that people aren't congregating around customer service desks just simply to check in. Many of the decisions, by the way, that I've just mentioned, or many of the physical changes that I've just mentioned, are expensive ones, especially the alterations to areas such as locker and change rooms where there's water involved. Wet areas are always the more expensive ones to renovate. So some of these are going to be quite expensive to deal with. Any physical changes that you can make that would increase the ability for you to introduce new air, fresh air, something as simple as opening windows or opening an exterior door. I know in many cases schools that do not have adequate or any air conditioning for that matter are simply opening windows in order to be able to introduce fresh air. And exterior doors as well. So that's the indoor environments. And as I say, I would encourage you to go onto the bench and look at the reports and pull the information that's pertinent to your situation there. In terms of outdoor, and this is quite interesting because, as I said at the introduction, people are very much interested in participating outdoors. Not only because of their safety, but also they've become used to it in many cases, and so consequently, it's not a foreign concept to them. And as you may wish to introduce this, I don't think it's necessarily going to be a tough sell because people are already moving in that direction. That outdoors is good and safe. There have been great examples of innovative approaches within the recreation sector across the country of new kinds of activities that have been introduced to get people or keep people active while keeping them in the outdoor environment. Some of them you can see listed here. The other thing which is also important, and I think I missed this from what I meant from a previous slide, public officials do understand that the general public is feeling better about, or at least they understand the contribution that recreation and sport have on the well-being of society. And so as a result, I'm personally seeing more and more acceptance at senior levels of decision-making within, especially municipalities, that we can't continue to try to do more with less when in fact the public is looking at this. Now, of course, the public is looking at this more positively. Now, of course, finances often do talk. So, I mean, I'm not suggesting for a moment that be minimized, but there is already fertile ground for the general public to accept that continued investment in sport and recreation facilities and activities, especially to make them safer in the long term, is a good investment. If we're going to ask people to participate outdoors, they have to be safe, but it also has to be convenient. And as we heard many times during the Reimagine Rec Project, that something as simple as offering washrooms in parks was seen, or not, was seen as a great limitation to actually getting people outdoors, even though we know the outdoor spaces were safer than indoor spaces. So better signage, outdoor washrooms, potentially offering Wi-Fi outdoors, that would encourage people to move outdoors and would offer them an environment within which they feel safe. So that's basically an overview of the engineering of those facilities, both indoors and outdoors, to try to make them safe. It's now time for us to break into our first breakout session. The discussion that you should have should be driven by these questions. What are you doing within your own jurisdiction, and what challenges have you faced? We're going to break for 15 minutes, as we had mentioned. This is something that's going to be facilitated. So MJ, I'll turn it over to you to break people into the groups.
Okay, everyone. I see everyone returning from their first breakout session. I am confident and hope that it was a great chat. I just wanted to mention on behalf of CPRA and the group that if you feel that you don't have anything to share or want to share in your breakout sessions, that's okay too. Lots to be gained from listening into the very rich conversations that will take place over the course of the next, say, 45 minutes as we wind into the second hour. I'm back, and we're going to move on to the next most effective set of controls, as you can see on the screen. And so how we administer all aspects of operations, programs, and the full scope of services in recreation, community sport, physical activity promotion continues to change, right? The proverbial sand is shifting under our feet. It is, in some cases, in some jurisdictions, still start and stop. But what is clear from the evidence and from the hierarchy of controls is that operating procedures under the guise, the broad term of administration, need to be in place in order to ensure the highest degree of mitigation of risk. And so administration in this case refers to generally to policies and procedures, education activities that are in place in your facilities and for consumers, scheduling and related activities that guide and support these standard operating procedures, or what we call SOPs. And whether it's to inform facility design or protecting staff and volunteers from risk, or ensuring the safety of your patrons, this level of control is together with elimination and substitution, of course, really important to ensure the safe return to recreation and community sport. So in terms of SOPs, or standard operating procedures, as one broad tranche of administrative controls, the SOPs include activities on this list as well as others. So we're going to just talk about several at this point. Let's explore COVID management plans. Some or most of your organizations may have in place distinct COVID management plans, perhaps under the guise of occupational health and safety committees, or even in tandem with public health officials. And the ideal here is that COVID management plans have three characteristics. One, that they are dedicated. In other words, dedicated to the issue of COVID management and COVID risk mitigation, and separate from other operating plans. The second is that they are documented, either digitally or in print or otherwise, for access by, of course, your staff and volunteers and relevant people within your facilities. And thirdly, and perhaps arguably, if not as important, even more important, and that is the opportunity to ensure that your staff and volunteers receive the appropriate training and supports to apply the COVID management plans in real time, in real practice. So importantly, it's recommended that CMPs include what's called case management plans. Of course, these are terminologies that you're hearing, in fact, living day to day in your facilities. And this includes contact tracing, of course, to mitigate community spread in the event of a suspected or a confirmed case. We won't talk today about new technologies. John has touched on some of that, or mobile ordering. But let's talk lastly for this slide about educational communications and communication activities targeting staff and volunteers, but also suppliers and patrons, obviously, with information to promote safety and to encourage them, obviously, to return to your facility, are and should be delivered in your facilities, but also obviously through other forms of external media, including social media. The evidence says that the focus should be on practicing safe behavior within our spaces, and of course, to decrease the risk of transmission. And this fourth graphic that you see here at the bottom speaks to the base of evidence that has been taken from the Reimagine Rec data that we gathered as it concerns the critical importance of communicating infection control practices. And so for some of the controls listed here, these can be considered in some ways part of facility design, but they're important. The important point to make here is that they're important to entrench in policies and procedures for staff and volunteers, right? That are documented, that are supported through training and other related means. So for example, facility capacity and spacing. John has spoken a little bit about this, but capacity is often dictated, as we know, by local or provincial territorial public health measures. And of course, spacing is related to maintaining a safe social distance. And these two graphics here point to the importance of embedding these controls related to entrances and corridors and pinch points, as John has talked before, in your plans, so that staff and volunteers have clear guidance. You may think it's intuitive. You may have lived experiences where you found out that staff and volunteers, while they see the relevance of these controls, they have difficulty applying them in real time, in real practice. And so the entrenchment of them in the policies and the case management plans and other related documentation and the training that supports that are critically important. Managing participant access with scheduling is also critically important. Increasingly, to build on John's point earlier, facilities are using staggered and time-based reservation systems. No doubt many of you are using these in your facilities already, often digital in their form, using smartphones. And they are, of course, there to ensure capacity thresholds and social distancing are maintained. And older adults, let's talk a little bit about at-risk clients and groups. We know that as people are welcome back and want to come back to our facilities and to participate in outdoor spaces, we will have a percentage of them who are at higher risk for COVID as a consequence of underlying health conditions, and those with disabilities are at greater risk from COVID generally as well. And so you can see here from this final graphic that at the front end of the COVID pandemic, globally, there was a study done to say that only 4% of online fitness videos were inclusive of those with disabilities as we began to offer hybrid and online programs. So whether in facility or by way of virtual programming, clearly it's important to account for and make allowances for those who are at higher risk than other subpopulation groups. It's an understatement to say that staff and volunteers are the lifeblood of recreation and community sport. You all know this. Many of you are volunteers. All of you are staff in some capacity. And so it's also an understatement to say that retention and attrition remain one of the biggest challenges for the sector. And for those who remain in the sector, they are challenged with new roles and responsibilities, often outside their previous work responsibilities. I'm sure that as we invite you into the next breakout session, you will have lots of anecdotal examples of how you've been taken away from your regular duties, either on an emergency basis or an ongoing basis as a consequence of the changes that are in place and that are entrenched as new administrative or new standard operating procedures. This is a challenge for everyone. And so as we look at the impacts, like the hospitality and related frontline services sector, recreation, sport, and staff have been the hardest hit across sectors in terms of major occupation group, and that's borne out in the data. Volunteers have exited and are difficult to entice back, in many cases, largely because of safety issues or perceived risk that is in front of them, and that's a challenge for the community as well. And incentives, flex time, hybrid hours, as well as training and skills building, which is critical to bolster the appropriate human resources, including specialized human resources, which are sometimes needed as a consequence of where we are now with COVID, is critical. And so you can see here from this final stat that over 50% of staff in one study were taken off their regular duties, which is really fundamental in terms of how we do our day-to-day business. And so these considerations should be taken into account in terms of your standard operating procedures. And again, as John has made the point, these are not small challenges. These have impacts on finances and planning and human resource training, et cetera, and on partnerships, which we're going to talk a little bit about as we move forward as well. And so on policy collaboration and partnership, each of you could give examples, probably many, of how and where you're now collaborating for the first time with others outside of recreation and sport, whether that be in public health, social services, public safety, mental health, food security in some cases, and others. And some of these connections may not be new, but the scope of those relationships are changing, where you are working in tandem or required to undertake outreach and partnerships and new working relationships with other officials from these other domains and sectors. And that's a challenge. So as a result, updated policies and procedures should support staff on how to broker, to respond, to manage, and generally speaking, to succeed in supporting new partnerships across sectors and domains. And it's really interesting to see that by way of the Reimagine Rec data that we collected, the evidence supports that there is high points of expectation among both stakeholder groups and consumers for better integration of community services. And so this has implications, of course, for community sport, for recreation, physical activity promotion. And those expectations are not limited to our sector. They are limited to community stakeholders and consumers who want different areas of community service to be working together in tandem and in an integrated way. And it's also true in meeting the needs of vulnerable populations, once again, whether in your facilities or in your communities. And so you can see that by way of this graphic, that data speaks to the expectation and the importance of making this happen for vulnerable populations as well. Integration of services is here to stay. This is nothing that will go away. And we've always made clear that the recreation sector is a leading agent of change and community sport in terms of partnerships and alliances and working across sectors and domains. But this will remain the case as we go forward and probably be a lasting change where people like you are challenged with working across domains and sectors in partnership with others. So with that, we would like to invite you to the next breakout session. The questions are similar, but we invite you to focus on these administrative issues, standard operating procedures, things of that nature, to address the question of in what ways are you and your organization mitigating the risk in terms of new or retrofit or changing standard operating procedures, and what are your main challenges in that regard? And so MJ, I'll pass it over to you to bring everyone into their respective breakouts.
Terrific. The last section or group of controls that we'd like to talk about is PPE and community controls. And as Joe mentioned during his presentation, it was brought to our attention during the planning for this session that we're really talking about two different audiences when we're talking about all of these measures, including the PPE and community controls. And those two audiences are the participants and the people that access your facilities as well as your staff. And so we know that there are different implications for each one of those groups, but the ability for you to provide them with some guidance and some support in those two groups is very important. This PPE initiatives were some of the first at the beginning of the pandemic. They were the first undertaken. As many of you might recall, personal protection equipment was scarce at the beginning of the pandemic, and in fact, there was a lot of hand wringing with respect to the need for it in the broader community and how it might impact the ability and availability of those different products for the healthcare sector and other sectors that typically would access protection equipment. The production of these things was ramped up pretty quickly, and the scarcity was reduced. It was not eliminated, but at least reduced. And so we'll talk about some of the implications of that now. So PPE and related support for staff. It's interesting because, of course, there are a variety of different applications and implications pertaining to this. First, in recreation, at least, we did not have to budget for personal protection equipment early on because that wasn't something that was really a requirement or even a thought prior to the pandemic. So there are budgeting issues that pertain to buying this information, or this material, and making sure that the material is on site and in quantities sufficient to protect your staff and offer, if you're so inclined to do so, masks, for example, for patrons. That is something that is being offered in certain situations, but there are budget implications associated with that. There's also training and healthcare protocols that need to be taken into account. This is something that you have to make yourself aware of. It's relatively new requirement to our sector. It's something that is accepted now and in many cases mandated, although not right across the country. We are also seeing that restructuring staff circumstances and schedules. I have personally seen situations where staff schedules have been adjusted to try to continue to deliver the level of service that is required in the facility and yet reduce the number of staff in order to be able to augment within the facility, the distancing requirements that are still very, very important. So restructuring staff schedules and circumstances is important as well. Staff will require support and training in terms of some of these. And it's interesting, some of the conversations I have had over the past little while, it's not just training in terms of how to use the PPE and how to describe the need for it, but also how to interact with clientele. What's the best messaging platforms and messages to deliver and how to deliver them? In other words, staff are on the front line of this, and we saw a lot and continue to see some evidence of people recognizing the importance of staff in the healthcare sector, especially nurses. But our staff are just as important as it relates to this. So they do need education, they do need support, and they do need our consideration in terms of how they are going to be scheduled, how are they going to be educated, how are they going to be trained in the use of some of these materials. And as I said, how do they best interact with their clientele on these needs. There are hybrid working models that are being adopted out there, with some people actually coming into work and others doing the work remotely, again, trying to provide the safest environment possible. And that comes along with the scheduling need. Staff need to be encouraged to lead by example. In other words, you can't be having staff directing people to do something that staff are not doing, such as mask wearing or mask wearing inappropriately. So that's something that needs to be reinforced. And also they may need help. And so during the introduction of passports or vaccine certificates that certain jurisdictions across the country have implemented, municipalities that have gone ahead and made those requirements, and in many cases they are in fact requirements, have had to hire additional support. In other words, even hiring security to deal with people who are entering and exiting buildings based upon the requirement for masking. So other community controls that we need to consider. People clearly are concerned about the safety for themselves and their children. That the safety is the #1 priority for people. That came through loud and clear with respect to the information we obtained through the Reimagine Rec process. It also is a reoccurring theme coming from other more recent publications. People are concerned about their safety, and consequently, many of the mitigations that we talked about earlier, while there is a small group of people that are going to push back and that are not going to be rapid adopters, the vast majority of people understand the need for many of these measures and welcome them, although to varying degrees of acceptance, because they need or they want to stay safe. We have seen situations where people are willing to accept the disruptions because of the safety enhancements that it offers. And I draw your attention to the general acceptance of people willing to embrace the hybrid service delivery models that I talked about earlier, i.e. maybe going to group exercise classes once or twice a week as opposed to 4 times, and then complementing that with remote participation the other 1 or 2 times. So people are willing to disrupt the type of use profiles that they did before, as long as they're able to continue to access the services and the facilities that they would like to, while at the same time remaining safe. And some people have talked about the convenience factor of that as well, as being an unintended consequence of that different delivery model. We know that the profiles are different in terms of the participation profiles are going to be different than they were prior to COVID. We know that people are interested in doing other things, and as I said in my earlier presentation, the outdoors playing a large part of that. And also, people do understand the need for sanitation. I personally use fitness centers quite a lot, and I must admit, we used to hang signs in fitness centers that said, "Please sanitize equipment before and after each use." People didn't necessarily always abide by that direction, but I can honestly say, just from personal experience, that there is more and more uptake on those kinds of directions. Other needs for support. Some of our research indicates that community sport organizations in many parts of the country really do require support because they are finding that their revenues and their operating budgets have been decimated by COVID. In some cases, they are willing to band together and combine the efforts, especially on things like administration, in order to be able to get things done at less expense. There may be an opportunity for public agencies to step in and assist in that regard. And I think that based on what we've heard, while registrations for #1 priority activities seems to be coming back strong in areas where it is allowed, we are seeing some evidence that especially younger age groups, parents are willing to register them in a single or possibly 2 organizational sports activities, and not 3 or 4 that they were registered in prior to the pandemic. So different use profiles are going to pop up across the system, and different people are going to require those kinds of supports. So with that, I'm going to ask us to break into our last breakout group. The questions, as you can see on the screen here, are to drive your conversations. And as Joe mentioned prior to the last breakout group, please feel free to offer information or offer input. But if it's a matter of listening to your colleagues and hearing what they have to say and learning from them, then that's useful as well. So MJ, if we can break into our group, that'd be great.
Please go to the bench. I'm going to be posting some stuff from this session, and just we can continue to have these discussions. And as Mike mentioned as well, please, if you could fill out the evaluation, we'd really appreciate it. It'll help us shape how we deliver these for the next 4. So thank you again to everybody, and have a swell day. We'll see you again soon.
Thanks, everyone.